Consider a teenager sitting alone in a dark room. Physically, they are isolated, but digitally, they are navigating a dense and chaotic ecosystem. In India alone, 154 million adolescents log into this environment every single day. This chart shows social media user growth and addiction trends from 2021 to 2027. Note the steep upward trajectory of the green line, representing teen addiction. It is rising at a significantly sharper angle than the baseline global user growth, coinciding with documented increases in sleep loss and clinical anxiety. When faced with these rising trends, many parents and educators default to confiscating devices or enforcing strict bans. However, research indicates this approach frequently results in higher levels of secrecy and can actually worsen a teenager's emotional distress. Dr. Gitesh Kumar Singh's FAME model, the Framework for Adolescent Media Engagement, shifts the research focus toward mapping the specific psychological drivers of digital behavior.
Protecting adolescent health requires us to navigate social media as a complex environment, moving beyond the binary choice of allowing or banning access. This FAME flowchart maps 5 levels of digital interaction, from initial psychological needs to final mental health outcomes. Level 1 addresses motivational needs. Adolescents use platforms to fulfill core human requirements for belongingness, identity formation, and autonomy. Moving to Level 2, platform selection, adolescents choose apps aligning with immediate psychological goals. Level 3 identifies contextual moderators, acknowledging that a teenager's offline baseline, specifically self-esteem and real-world support, determines how they react to online content. A teenager's offline reality dictates their online resilience. Those with strong real-world support networks possess a built-in buffer against stressors encountered in digital spaces. Returning to the FAME flowchart, we arrive at Level 4, mediating mechanisms. This is the stage where the specific style of engagement dictates the degree of risk to the user. Engagement follows 2 paths. Active use, like messaging friends or creating content, can foster social support. Passive use, which involves mindless scrolling, often triggers toxic social comparison and FOMO. FOMO, or fear of missing out, is the anxiety that others are having rewarding experiences while the user is absent. Extended passive scrolling activates the displacement hypothesis. This theory suggests that digital media use pushes out time normally spent on healthy habits, like physical activity or essential sleep. As these negative mechanisms compound, the duration of use becomes a critical risk factor. This diagram illustrates usage thresholds based on mental health outcomes. Daily use under 1 hour is categorized as normal use and is considered safe. Between 1 and 2 hours is moderate use, which requires regular self-monitoring to maintain well-being. The risk profile changes as time increases. 2 to 3 hours of use is linked to mild anxiety. However, crossing the 3-hour threshold correlates with a sharp spike in risks for severe depression and chronic sleep disturbances. When daily use exceeds 3 hours, the cumulative pressure of passive scrolling often exceeds a teenager's psychological capacity to cope. In longitudinal studies, frequent users are 10% more likely to report high psychological stress than their infrequent counterparts. How can parents effectively intervene in this cycle without encouraging secrecy? One effective strategy is active mediation. Active mediation is a collaborative parenting style where adults engage in open discussions about online content and stressors, helping the teenager build critical digital literacy rather than relying on strict control. To protect sleep, families can establish a digital curfew 1 hour before bed. This reduces blue light exposure and limits late-night digital emotional contagion. Digital emotional contagion is the rapid spread of moods or feelings from online posts to the person viewing them. Physical health is maintained through the 60-minute rule. This involves replacing 1 hour of passive scrolling with 60 minutes of daily physical activity, which helps rebuild the offline self-esteem that social media can diminish. Social media is an integral part of modern adolescent life. Resilience is built when parents use the FAME framework to guide their children through this environment, rather than attempting to block it out entirely.